Here's a detailed overview of epinephrine covering all the requested points. 1. Generic name, drug class, brand name. Generic name epinephrine, drug class, sympathomimetic agent, adrenergic agonist non-selective, catecholamine, brand names EpiPen, adrenaline, Alvi-Q, Simpi. Definition. Epinephrine is a synthetic form of a naturally occurring hormone, adrenaline, used in emergency treatment of life-threatening allergic reactions, anaphylaxis, cardiac arrest, and asthma attacks. It works by stimulating alpha and beta-adrenergic receptors. 3. Mechanism of action. Epinephrine acts on both alpha and beta-adrenergic receptors. Alpha-1, vasoconstriction, increases blood pressure. Beta-1, increases heart rate and myocardial contractility. Beta-2, bronchodilation and decreased mediator release from mast cells. 4. Indications: anaphylaxis, severe allergic reaction, cardiac arrest, asystole, pulseless electrical activity, ventricular fibrillation, severe asthma attacks or bronchospasm, croup as racemic epinephrine, hypotension and shock as adjunct. 5. Contraindications. There are no absolute contraindications in life-threatening situations like anaphylaxis. However, relative contraindications include hypersensitivity to epinephrine or any component of the formulation, rare. Use with caution in patients with cardiovascular diseases, arrhythmias, hypertension, angina, hyperthyroidism, diabetes mellitus. Before taking this medicine, precautions. Inform your doctor if you have a history of heart disease, high blood pressure, thyroid disorders, diabetes, Parkinson's disease. Avoid injecting into buttocks, fingers, toes, or hands due to risk of tissue necrosis. Monitor for drug interactions, e.g. with beta blockers, MAO inhibitors. 7. How to use. Auto-injector EpiPen. 1. Remove safety cap. 2. Swing and push firmly into the outer thigh at a 90-degree angle. 3. Hold for 3 to 10 seconds. Massage the area for 10 seconds after injection. Can be injected through clothing. Always seek emergency medical attention after use. 8. Dosing information. Anaphylaxis, IM injection. Adults, 0.3 to 0.5 milligrams IM every 5 to 15 minutes as needed. Children, 30 kilograms, 0.01 milligram kilogram IM, max 0.3 milligrams. Cardiac arrest, IVIO. Adults, 1 milligrams IV every 3 to 5 minutes during resuscitation. Pediatrics, 0.01 milligrams kilogram IV every 3 to 5 minutes. Asthma, subcutaneous or IM, 0.1 milligrams per kilogram every 20 minutes for up to 3 doses, max 0.5 milligrams per dose. 9. Miss a dose overdose, not applicable in emergency use. Overdose, symptoms, hypertension, stroke, tachyarrhythmias, pulmonary edema. Management, supportive care, beta blockers, e.g. Libolol for severe hypertension. Over 10. Stop or avoid taking. Discontinue only under medical advice. Avoid repeated unnecessary doses due to risk of cardiac complications. Avoid use in areas of end arterial supply, fingers, nose, etc. Hand 11. Side effects in detail. Common side effects: nervousness, tremors, headache, palpitations, sweating, nausea, vomiting. Serious side effects: arrhythmias, tachycardia, ventricular fibrillation, hypertensive crisis, myocardial ischemia or infarction, cerebral hemorrhage, pulmonary edema, injection site necrosis, especially with accidental digital injection. 12. Vital information. Always carry an epinephrine auto-injector if you have a history of severe allergies. Seek emergency help after administration. Effects are short-lived. Check expiration date regularly. Ensure proper training in auto-injector use. Educate caregivers, teachers, or coworkers if you're at risk of anaphylaxis. 13. Other drugs will affect epinephrine. Drug interactions. Beta blockers, e.g. propranolol, may reduce bronchodilation and increase blood pressure. MAO inhibitors, e.g. phenelzine, may potentiate effects, hypertensive crisis. Tricyclic antidepressants, e.g. amitriptyline, may enhance pressor response. Digoxin, risk of arrhythmias. Diuretics, may worsen electrolyte imbalance. Thank you. Have a nice day.